Celiac disease is a complex autoimmune inflammatory disorder of the intestine that is triggered by the protein gluten that is found in wheat, barley, or rye, and it activates an immune response. And this culminates in injury to the lining of the small intestine, and that's where we absorb a lot of really important nutrients. Also, unchecked inflammation could predispose you to malignancies. The classical symptoms for celiac disease are bloating, diarrhea, and the sense of not feeling well in the stomach. We look for inflammation, we look for destruction of the villi, which are finger-like projections where you absorb nutrients. And this, in combination with the blood test, gives us a good sense of whether you have the disease or not. The major players that predispose a patient to celiac disease are genetics, also the immune system, as well as our interaction with the environment. We know that over 99% of patients with celiac disease carry one of two genes, HLA-DQ2 and HLA-DQ8. Having these genes doesn't mean that you'll get celiac disease. It's only a risk. We always recommend that if you have a first-degree relative who has celiac disease, that you should be screened for celiac disease. The only treatment to date that is effective is the gluten-free diet. Most of the time when patients go on a gluten-free diet, it's effective and patients do well. However, there are other conditions that you can see with patients with celiac disease, such as bacterial overgrowth. Our digestive health team here is very in tune to treating celiac disease. Gluten could be found in many places that people wouldn't know, such as soy sauce, for instance. So it requires counseling, and one of the things that we provide here at Stanford is an expert dietitian who works very closely with us on the clinical side to help patients through adopting a gluten-free diet. One of the things that I find unique about Stanford is that we have a lot of really amazing immunology researchers. And I'm hopeful that there'll be more treatment options. And it's conceivable that we may someday have a vaccine that would prevent the disease going forward.